Hi, my name is Dr. Mary Fink. I'm a neuromuscular physical therapist at ESP Sports Medicine in Lafayette, Colorado. I just wanted to do this video to explain some of the reasons in which you could have persistent symptoms from post-concussion syndrome. This is my specialty. I've worked with brain injury for 10 years, and my father unfortunately suffered a traumatic brain injury from a car accident. So it's a passion of mine just to help people understand this injury and what to do about it. So I just wanted to talk about the different things that can cause ongoing symptoms. And those symptoms can be headaches, dizziness, blurry vision, emotional, cognitive changes, light sensitivity, sound sensitivity, ringing in the ears. Those are some of the major symptoms that people have. So the first thing that can cause this, and sometimes there can be a conglomeration of causes. We usually say it's like unpeeling the layers of an onion. So commonly, and this is what I treat, is the visual and the vestibular effects, which can be from the eyes not coordinating to work quickly enough or focusing in and out, because the cranial nerves, which go from the eye and the muscles around the eye to the brain, have been either torn or stretched. And oftentimes, 95% of the time, this doesn't show up on an MRI or a CAT scan because it's a neurochemical change in the brain. So we work on retraining the eyes in a slow and steady way that allows the brain to kind of heal. When there's just that short circuit, we're just finding a neural pathway around the path that's not connecting. And so there's billions of neurons in the brain, and we just use different pathways to make new connections. This is supported with evidence and literature as to how it can positively help with retraining the brain. Also, the balance system, your vestibular system, is this very small structure about the size of my pinky, deep in your inner ear, past your eardrum. A lot of people say, well, they looked in my ear and they didn't see anything. So this is a structure very deep in there, and it is compromised of different systems that tell your brain where your head is in space, in combination with your eyes and your sensory input from your feet, help you balance. So oftentimes you can have a labyrinthine concussion where the inner ear system is concussed. And so we give you appropriate exercises to kind of recalibrate that system and reground your roots like you're a tree, just kind of getting stabilized back on the earth so you don't feel so disconnected. And a lot of people coming in, touching on the walls, or they just feel like they need to hold on to something. And usually within a week or so, with the right exercises, you can feel better grounded. So the first thing was the visual and vestibular system. Also, the next thing would be the neck. And oftentimes most people have a whiplash injury associated with a concussion, and you can have almost identical symptoms from a whiplash as a concussion. So it's kind of hard to tease that out, but we can treat the neck, and we can treat tension in the neck and the facet joints or other sensory input that might be disrupted from the whiplash. And once we treat the neck, oh, my headache's 50% better. So we know that that headache was coming from the neck component as well. Also, your eyes are directly connected to your suboccipital muscles in the back. And so when you move your eyes around, you can feel those muscles fire. So there can be a direct correlation between eye pain and headaches and neck pain. So that's one area that can be affected. The next thing would be your blood flow to your brain or your autonomic nervous system. And so if you're getting too much blood flow, that can give you symptoms. Oftentimes we need to increase perfusion to the brain to help it heal. Oxygenation helps the brain heal. So we give people a sub-maximal threshold exercise program, often using the Buffalo concussion treadmill test, or we use a bike as well. But you work up to sub-threshold symptoms to help bring oxygen to the brain. And then when things start getting not feeling so great, then you got to kind of back off. So you kind of just build up on that program. So even walking and doing gentle exercise can be helpful for healing as well. Another area that can be often affected is the hormonal system or inflammation. We talk a lot about the brain-gut axis and how this is all connected. And so oftentimes food and getting the right supplementation can be critical with your brain healing. Eating a lot of sugar and gluten and things that fast food is not going to help your brain heal. We talk about neurotoxic things such as alcohol or smoking is not good for helping bring oxygen to the brain to help it heal. So there can be, usually more with severe traumatic brain injury, we can see a hormonal change, but people can have changes in menstruation or puberty from a concussion. And I've had quite a few people come in and go, do you think this is related to my concussion? And I'm like, well, it was fine before, and then you had this just massive insult of hormonal changes to your brain. So we can do tests to see, the doctors can run a hormonal panel to see if anything's off. So there are some supplements that can be good. It's just kind of, fish oil and turmeric, curcumin, those can be good anti-inflammatory for the brain. It's just you don't want to over bombard financially people with too many things to take just as a magic pill, because there isn't one. So those can be things that can be helpful as well. Another thing that's really important is sleep. And I think all of us have felt that at some point in our lives, that if you don't get enough sleep, it's hard to remember things, it's hard to function and focus. So we always encourage people different strategies with meditation and deep breathing and yoga, trying to get sleep to improve, because at night your brain actually heals those neurons. So sleep is one of the most critical things when healing from a concussion. The last thing I just wanted to mention is the psychological effect of concussion, like anxiety or depression. A lot of the times people just don't feel like themselves. I can't go socialize, I can't go to large crowds, I can't even go to the grocery store. So it becomes very depressing and isolating. So if you can treat the symptoms and get everything falling into place, hopefully that will carry over also to the psychological effects of a concussion. Oftentimes patients are diagnosed with depression and given a pill for that, or anxiety and given medicine for that, but it's just all a side effect of their concussion or their whiplash symptoms. So if we can improve the symptoms, usually patients' scoring will come down with the questionnaire that we do, and they'll say, oh, I'm feeling more like myself, I can interact with my kids more. So it's really important to look at all of these aspects of concussion and kind of get the right help. We are a resource to the community, and I'm hoping to reach out to the world and have more people telecommunicate with me so I can help them. Even if it's been years, there is still healing that can happen. So you can always check out more information on our website, espsportsmedicine.com. I hope that you find this information helpful, and I wish you well in your healing process.